Hello and welcome. Today we're diving into a serious and often overlooked heart condition, Chagas disease, also known as American trypanosomiasis. It's a parasitic infection that can lead to significant heart problems, even decades after the initial infection. This video will explore what Chagas disease is, how it affects the heart, and what can be done about it. Chagas disease is caused by the parasite Trypanosoma cruzi. This parasite is primarily transmitted to humans and other mammals through the bite of infected triatomine bugs, also known as kissing bugs or assassin bugs. These bugs typically live in the cracks and crevices of poorly constructed homes in rural areas. When the bug bites, it defecates, and the parasite, containing feces, can enter the body through the bite wound, mucous membranes, or breaks in the skin. Transmission can also occur through blood transfusions, organ transplantation, congenital transmission from mother to child, and less commonly, through contaminated food or accidental laboratory exposure. Once inside the body, Trypanosoma cruzi multiplies and spreads throughout the bloodstream, infecting various tissues, including the heart muscle. Initially, there's an acute phase of infection. If left untreated, the parasite can persist in the body for decades, leading to a chronic phase. In the chronic phase, the parasite can cause inflammation and damage to the heart muscle, leading to cardiomegaly, or enlargement of the heart, arrhythmias, and heart failure. The parasite can also affect the digestive system, leading to megacolon and megaesophagus. The exact mechanisms of cardiac damage are complex and involve a combination of direct parasitic injury, inflammation, and autoimmune responses. Chagas disease is endemic to Latin America, particularly in rural areas of Mexico, Central America, and South America. It's estimated that millions of people are infected worldwide. However, due to migration, Chagas disease is increasingly being diagnosed in non-endemic countries, including the United States, Canada, and Europe. Public health efforts are focused on controlling the insect vectors, screening blood supplies, and educating communities about prevention. The signs and symptoms of Chagas disease vary depending on the stage of infection. During the acute phase, which may last only a few weeks or months, some people may experience mild or no symptoms. Others may have flu-like symptoms such as fever, fatigue, body aches, headache, rash, loss of appetite, diarrhea, and vomiting. A visible swelling, called a chagoma, may appear at the site of the insect bite. In the chronic phase, which can develop years or even decades after the initial infection, many people remain asymptomatic for life. However, approximately 20–30% of chronically infected individuals will develop cardiac complications, including heart failure, arrhythmias, and sudden cardiac death. Digestive problems, such as difficulty swallowing, dysphagia, and constipation, can also occur. Diagnosis of Chagas disease typically involves blood tests to detect the presence of Trypanosoma cruzi antibodies or the parasite itself. During the acute phase, the parasite can often be directly observed in blood samples using microscopic examination. In the chronic phase, antibody tests are more commonly used. Electrocardiograms, echocardiograms, and chest X-rays are used to assess the extent of cardiac involvement. A physical examination can also reveal signs like an enlarged heart, abnormal heart sounds, or swelling. While Chagas disease doesn't have distinct formal subtypes in the same way as other heart conditions, the manifestation of the chronic stage varies considerably. Some individuals develop primarily cardiac disease, characterized by heart failure, arrhythmias, and conduction abnormalities. Others develop primarily gastrointestinal disease with megacolon and megaesophagus. And of course, many experience a combination of both or remain asymptomatic for life. Understanding these different presentations is crucial for tailored management. Treatment for Chagas disease involves antiparasitic medications, such as benzodazole and nifurtimox, which are most effective during the acute phase of infection. In the chronic phase, these medications may still be used, but their effectiveness is lower, and they can have significant side effects. Treatment for cardiac complications includes medications to manage heart failure, arrhythmias, and other cardiovascular issues. Pacemakers and implantable cardioverter defibrillators may be necessary to prevent sudden cardiac death. For patients with severe heart failure, heart transplantation may be considered. Management also involves routine cardiac monitoring to detect and treat any emerging cardiac issues. Prevention of Chagas disease focuses on controlling the triatomine bugs, also known as kissing bugs. This includes spraying insecticides inside homes, improving housing construction to eliminate cracks and crevices where the bugs can live, and using bed nets. Blood screening is crucial to prevent transmission through transfusions. Pregnant women in endemic areas should be screened to prevent congenital transmission. Food safety measures, such as proper hygiene and cooking techniques, can help prevent oral transmission. Personal protective measures when traveling to endemic areas can also lower the risk. The prognosis for Chagas disease varies depending on the stage of infection and the extent of cardiac involvement. Early diagnosis and treatment can significantly improve outcomes and prevent the development of chronic complications. However, even with treatment, some individuals may still develop cardiac disease. Recent research is focused on developing more effective and safer antiparasitic medications, understanding the mechanisms of cardiac damage, and identifying biomarkers to predict disease progression. Studies are also exploring the potential role of immunotherapy in treating chronic Chagas disease. Advances in cardiac imaging techniques are also improving the ability to detect and monitor cardiac abnormalities.